I'm very pleased with how today went. What an amazing morning. We had people from EFIC, we had researchers, we had clinicians, we had patient representatives from PAE, we had a representative from the UN, and we had our MEPs.
It has been a pleasure to co-host and speak at the CIP's event on access to treatment. Pain is influenced but not only biological but also psychological and social factors. Therefore, effective pain management must consider the interplay between emotional, physical, social and psychological factors for a holistic approach. Social elements like emotional support and financial security have very significant influence on pain outcomes and a patient's quality of life. A better understanding of pain and its relevance will support and inform future policies and treatment accessibility strategies.
The pain is a very important tool in our hands. First of all, it allows us to diagnose, to help people, to address immediately, and to have in our hands early diagnosis, early treatment, and early prevention. On the other hand, pain is chronic condition, and it challenges people, especially in their oldest situation. And we need to address pain issues in a very common way. From one hand, delivering treatment if it's needed, and from another hand, to provide services to manage pain to those who are staying in chronic conditions.
As members of the European Parliament, we have a responsibility to ensure that all citizens have adequate access to pain treatment and management services. Together, let us commit to a Europe where no one has to suffer in silence and where pain management is a fundamental aspect of our healthcare system. Thanks a lot.
Pain is something very important. It affects a very large number of people, and we have to do whatever we can to put a focus on this, both in European Union policy making, but also in national policy making. Inclusion of pain as a health condition in ICD 11 is very important. This also helps us to bring it forth in European Union official documents. We have some references already on that, and this is something which is very important. I personally will continue to advocate for more focus on and more emphasis on pain, also especially on social impact of pain, on more research and gathering more data on pain, and I think that the European Union has a bigger role to play there, and I'll continue to fight for that.
I'm happy how we are talking about the digital realm and also new opportunities for healthcare professionals, teachers, and not teachers, but treat us and also teachers. So I'm really happy how this day go. Thank you for everyone who attends.
So we should not discuss opioids on its own. It needs to be, the story of opioids needs to be discussed by acknowledging that pain is a biopsychosocial disease, and this needs to be treated as such.
We are happy that the results are there. They will be published very soon in the European Journal of Pain, and I hope that this could translate into higher pain research funding from Europe, and especially for you all to know which are the evidence-based priorities in pain research for the next decade. Thanks for being there.
We know that prevention is better than cure, and vaccination is a key tool within prevention. So now is the time really for governments to invest in these tools, to offer shingles vaccinations free of charge, to streamline the vaccine process and make it more accessible, and to also engage more widely in comprehensive communication campaigns to really make sure that the level of knowledge people have about their health and risks to their health is clear.
There is a big gap in the availability and access to controlled medicines for people all over the world, but especially in low and middle income countries. Participating in this event has given me the opportunity to witness and to get a lot of information firsthand from European experts trying to improve the living conditions and quality of life of people in Europe. There are lots of lessons learned, lots of interesting information that I will bring to my daily work in the United Nations to benefit the poorest around the world.
We want to ensure that Ursula von der Leyen, President of the European Commission, when she talks about ensuring that there's adequate access to painkillers across Europe, that she knows what that means, and she knows what pain treatment means in the broadest context. We're here to ensure that we can give her the guidance from an expert perspective, working with patients to give that perspective too. So there's a lot to do, and we're going to be working really hard in 2025.